Reflux relief, PPIs versus the new antacid medication. The name of the drug is called Vonoprazan, and let's look at the pros and cons. If you suffer from acid reflux, if your current medication isn't really working for you, if you tend to awaken at night with acid reflux, meaning the medication's not lasting long enough, then this is something you can look into. Now, there's always pros and cons with medication, so I want to jump right into it. Vonoprazan is a fairly new drug. It's been in Japan for 10 years. It was only approved here in the US 2022 and 2023 for treating H. pylori, so Helicobacter infections. These are in your stomach and can lead to stomach cancer, so it's important that you rid yourself of the infection if you have it. And this particular drug, in combination with others, has been deemed to be more effective than a PPI was in combination with other drugs. So there's a multiple therapy that is used to treat H. pylori. So in Japan, they definitely have a problem with this, and they came out with this drug because it seemed to do better for treating H. pylori infections. And I agree they need to be treated. There are natural ways of treating it, but it's a 7 to 14 day course. In Japan, they just use it for 7 days. Here in the US, we use it for 10 to 14 days, but it's a limited course, and you're killing this bacteria that can certainly create negative effects. So I don't have any trouble with that. It's also used for something called erosive esophagitis. So you're getting erosions in your esophagus due to acid reflux. Now, there's a short-term scope of it, which is 4 to 8 weeks. So again, that's not very long, so that's fine. But if people are still having symptoms, if they have a hiatal hernia, if they have Barrett's esophagus, if they're obese, then they can be in the category for using it continuously because they continue to have symptoms. So let's look at how Vonoprazan works, side effects, etc. Now, it is a very strong acid reducer. It's stronger even than a proton pump inhibitor, a PPI. So what we know happens with that is when you reduce acid, you reduce your body's inherent natural ability to kill bad organisms. That from the mouth, from the esophagus, we ingest organisms, we have them growing in our mouth, that it is normal in our food, in our mouth. You swallow, it gets into the stomach. But that's why the stomach is a bag of acid, because it's designed to kill these bacteria immediately. So then you don't have a proliferation of bad bacteria. The good bacteria multiply, and you have a nice balance in what's called your microbiome, which is your 60 to 100 trillion organisms in your colon. So this new drug, Vonoprazan, has the same issues. It is newer on the market, so research is newer, but they're seeing the same effects. And I have all the research studies in the description of this video, so you can look at those. But not surprising, it's having the same issues that the proton pump inhibitors have from this viewpoint of too many bad bacteria. The problem with that is those bad bacteria create a lot of pressure that presses on your stomach, forces acid up into your esophagus, and so it's creating the very problem that you are taking the drug to handle. So that's an issue that you want to know about. Also, symptom-wise, it creates, well, again, because of diminishing acid absorption, you're losing your ability to absorb vitamin B12, magnesium, calcium, iron, folate, and the side effects, it's akin to the PPIs, which are, you can get osteoporosis, B12 deficiency, magnesium deficiency, you can feel tired, you can get polyps in your stomach, and also the effects of diarrhea, stomach pain, bloat, nausea. This drug, Vonoprazan, also can change your taste, so that was a little different than PPIs, so you don't have the same sense of taste. Also fluid retention, which is also known as edema, causing kidney injury and skin rash. So those were some additional symptoms that this drug showed. It also showed the liability of getting a certain infection that can create very intense diarrhea. We call it C. diff for short. It's Clostridium difficile. The issue with that is that it can be life-threatening if the diarrhea gets too severe. So that again is akin to what PPIs show. So that is the same, reducing the beneficial bacteria, allowing bad bacteria to procreate. They have that in common. So what does it do? It acts faster. So instead of taking sort of 2 weeks to feel the effects, it's almost immediate. It lasts longer, lasts 24 hours. So patients who have the reflux at the end of the day or in the middle of the night because the drug wore off, they don't have that effect. And it also doesn't have to be tied to meals, so it's more convenient for people who don't want that timing of a half an hour to an hour before meals, trying to remember it. It's not tied to meals because it lasts so long. So those are the kind of ease of administration that this drug has. And also it's used for the H. pylori infections. It's used for the erosive esophagitis. It's erosions, it's like ulcers in your esophagus. And it's also used if somebody is a PPI non-responder. So they're taking a PPI and they're just not feeling any different because of it, then this drug can be used. It is more expensive. It might not be covered by insurance because it's new. And also because it's new to us, we don't know the full effects. PPIs have been around for 30 years, so we really know all those side effects from osteoporosis, increased risk of dementia, heart issues, osteoporosis. There's a long list of side effects, and we know them very well because there's been 30 years to figure them out. This drug is newer, and as I said, early research shows it's got similar liabilities, but just so you know, those are the options. One thing, if somebody is a PPI non-responder, meaning something that's a strong antacid is not changing your symptoms, you do want to find a clinician who can discern if you actually have bile reflux that is greater than acid reflux, because bile comes from your gallbladder. Much like your stomach acid, it should not be going up your esophagus. Stomach acid should stay in your stomach, and bile, your gallbladder, secretes that into your small intestine, and it's used to also kill bad bacteria and break down fats, so absorb fat-soluble vitamins A, D, E, K. So when it is coming up into the esophagus, it is just as corrosive as acid. So you've got acid and then bile, which is very alkaline, so it's on the other end of the pH spectrum, just as corrosive, if not worse. So sometimes, because the symptoms are so similar, you have the burning, you have you can have the bad taste in your mouth, etc. So finding a clinician who can ascertain, is this bile versus acid? And that's why acid, reducing medication is not working, because it's not acid, it's bile. That is something that could be very helpful for you. Also, as we get older, we naturally tend to produce less acid. So having those symptoms sometimes really diminish with age, but if you keep having the symptoms, there's other reasons. Another one of which is that the bacteria in your esophagus can be aberrative, not being killed as they should be due to acid reflux and imbalance in your microbiome. And so these bacteria literally make your nerve endings more sensitive. So even a little bit of acid in your food or a tiny little bit of reflux can feel like a lot just because you're more sensitized. So these are the things I want you to look into if you feel like you're a non-responder and now you understand this new drug on the market, and you can ascertain whether that's something that would be beneficial for you or not. Okay, I hope you found this informative. If you did, give it a thumbs up, like the channel, and subscribe. And send a comment. I love your comments. I answer pretty much all of them, and I look forward to hearing from you. We'll talk soon.